heart failure is a tremendous problem in the United States. Heart failures become much more prevalent, especially with people as they get older. It used to be that patients had a heart attack and many times they died from them. Well, now emergent care is much better and patients are surviving those initial events, but the heart damage has been done. A heart failure navigator actually helps patients find their way through the hospital system when they've been diagnosed with an acute episode of heart failure. To get them to improve their quality of life and help take care of themselves requires patient education, and that's where I come in. I can take from 30 minutes to an hour to sit down and talk to a patient or family and really discuss what heart failure symptoms are, discuss their medications, help them recognize signs and symptoms of heart failure, and then make sure that they understand what to do when they do have problems. We wanted to see if there was a reduction in heart failure readmission, and we also wanted to see if we could reduce the length of stay. A patient wants to know that they can come into the hospital, have the things done for them that need to be done, and they see an improvement and they get to go home. And what we were able to demonstrate with the project was that we had a dramatic reduction in readmission rate on heart failure patients. We also had a reduction in length of stay to about 4 days. And we saw an improvement in patient and the physician satisfaction. I get to measure whether or not I'm effective at what I do. By seeing if a patient is returning to the hospital frequently, I know whether or not they have learned to take care of themselves. So if there's a reduction in the readmission rate on any given patient, I feel like I'm doing a good job. The things that I like best about working as a heart failure navigator is the patient contact. I can hold a hand, I can pat an arm, I can stop and pause. We can inject some humor, change topics for a moment, ask about life experiences, all of those things that help put people at ease. Unfortunately, some of the things that we need to talk about are difficult. It's hard for a patient to hear that what they have is a chronic problem. Actually, what's interesting is that when I walk in a room and I find out that patients and family speak Spanish only, the biggest surprise for them is that I'm bilingual. What I've found is that patients relax even more. They feel like somebody understands what their needs are when you're able to communicate with them in their preferred language.